That's Jill. Well, you know, it's not peak cold and flu season just yet, but it is already hitting some areas hard. So we wanted to bring in a doctor to talk about some of the ways you can stay healthy during the winter time. Here is Dr. Adam Lett from Summit Medical Center. Thank you for being with us.
Absolutely.
Summit Medical, I should say. Now, first off, are you already seeing more patients with cold and flu?
Absolutely. This is definitely flu and cold season. We're starting to see some flu positive test results in our clinic and several other clinics around this time of year. Definitely the height of cold season right now. I've seen several of those for sure in definitely the past couple of weeks.
And several schools have closed in our area, so we know that, boy, once it gets started, it runs through a school.
Absolutely. Very common. Passed along from kids in close contact, family members who, develop symptoms, passing on to other family members, work and school and close contacts. It's very, very common to pass along easily.
Just in case someone doesn't know, let's talk about the symptoms people should look out for and the difference between cold and flu.
Sure, absolutely. So really with either one, you can have some fevers. Flu is more common to have a little bit higher grade fevers. Definitely can cause significant malaise or fatigue where you just feel very, very tired and drowsy and groggy. Coughing symptoms can definitely go with both. Sometimes it's difficult to distinguish between the two. Flu is usually a little bit more significant with the type of symptoms with how one feels.
You just feel really bleh with the flu.
Absolutely, that's a good way of putting it.
Even more so
very
than
much
the cold.
so.
That's a journalistic term. We all know washing hands can keep the germs away. So we got that down, hopefully, and if you don't, you need to do that. But what are some other ways we can stay healthy?
Absolutely. So avoiding close contact with people, of course, if you are sick or know someone who's sick, trying not to get up in their face, things like that. Cough, things your mother told you, growing up, it applied back then as it does today, coughing into your shoulder, your elbow, things like that. Staying home if you're truly sick, if you have a fever, trying not to go to work or school if possible. And most importantly for flu is getting the flu vaccine really prior to the season starting.
I wanted to ask you that because you said prior to the season starting. Is it too late to get it now?
Absolutely not. The flu vaccine supplies are starting to run a little bit more limited, definitely this time of year, but there are several places and clinics and pharmacies that still have them available. So I'd contact different clinics and pharmacies to still, if they have them. It's definitely indicated for every individual above the age of 6 months, especially the elderly, young children, pregnant patients, and those with any chronic medical conditions that can make them a little bit more susceptible to having more significant outcomes from the flu that are worse.
I have some seniors ask me this a lot when I'm out covering medical stories, and they wonder about the pneumonia vaccine. Should they get that along with the flu vaccine, or is that too much?
No, you can't. No, you can definitely get both. Depending on what kind of medical problems you have, flu vaccines are indicated for everyone. The ages 65 and older are indicated to have a pneumonia shot as well as a flu shot. And for those aged 65 and older, they actually recommend now a higher, a more powerful dose of the flu shot. There's one with a quadrivalent virus that is recommended now. But no, they definitely can get both shots.
Very good. All right. Doctor, thank you so much. Wonderful advice. I know people listening, that'll help you try to keep your family healthy and have a wonderful holiday. So thank you.
Thank you. I appreciate it.
All righty. Bo?
All right. Thank you, Lori.